Hello again. The Health Minister, Dr. Joe Phaahla, has extended the deadline for public comment on COVID-19 health regulations. Now you have until the 24th of this month to air your views and make your comments. The Minister has pleaded with the public not to panic about these proposed amendments because he says they are not completely new. Let's get some reaction now and some analysis from Professor Alex van der Heever joining us now virtually. Prof, good afternoon and thank you very much for your time. Just first up, I mean, is it a good thing or not that there's been an extension? Because people were concerned about the time that was given up to the 16th of April. Is this extra week welcome?
I think it is appropriate to extend it. The question is whether the extension is an appropriate extension. I think that there are a lot of issues that arise from these regulations given the very, very limited enabling provisions in the National Health Act. And so there's quite a lot to consider when you've got measures which allow for fairly draconian actions to supposedly be supported by legislation. And so I think that it needs a lot of thought.
Yeah, the minister was at pains saying that in their view, the government is trying to ensure that South Africa does not lose the gains it has achieved in how it was managing COVID-19. Is that a fair enough position to express to us?
I'm not sure what gains he's referring to. The question is now, first of all, what the risk is with COVID going forward. But it's important to note that the regulations don't refer to COVID. They refer to notifiable conditions. And there are a large number of notifiable conditions. And theoretically, with these provisions, all of these actions can be instituted on any notifiable condition. And there's no balance provided in the regulations to assess the appropriateness of the risk associated with testing, forced medical treatment, confinement, etc. And in many cases, it might be absolutely inappropriate. It's also unclear who the decision maker is in any of these processes and what the governance framework is. So because it's not just COVID, it's notifiable conditions, which include flu, TB, Ebola, and a whole host of other conditions, notifiable conditions that don't have the same kind of risk matrix as COVID. The question is really whether these regulations are appropriate as a general framework.
Yeah, I mean, just thinking about some of them that are sort of being proposed to remain, I was trying to wrap my head around them. I, for instance, don't understand why we would still be required. I mean, these are draft regulations, granted, and people are making comments like we are. We've got until next week, and we don't know what the final ones would look like. But I mean, why would you still be insisting, for example, on PCR tests for travelers under these health regulations, which are covering notifiable diseases, not just COVID-19?
Exactly. So what you would require in the regulations is some process of prioritization, because you've got to basically match your intervention with the relevant risk, and not all notifiable conditions have the same degree of risk. And so what you can't do is give powers to the minister or to any health authority. I don't know who's to exercise any of these powers ultimately. You can't just give it and allocate it without having some kind of process that assesses proportionality. And there is nothing of that in this. So, for instance, certain flus are notifiable conditions. And everything that's in here could theoretically be done to you by some decision maker who's unclear in the regulations, just because you've got a notifiable condition. So where are the checks and balances to ensure that there is no inappropriate behavior by any authorized person? Noting, of course, that the regulations don't clarify who an authorized person in this framework actually is. I think the other major issue is you don't let a minister have the powers to basically do all of this on the basis of, one line in the National Health Act, which is the minister can make regulations in relation to notifiable conditions. This is quite heavy. for such a very limited enabling provision and probably would be legally challenged.
Yes, already Action SA's Herman Mashava saying his party is thinking of going to court over these if these become implemented. But the minister is saying this is not an attempt to control South Africans. I mean, those are words he used, and also they won't be here forever. But I mean, why would you need them? For example, we're going to a winter season. Somebody could have a high temperature when they're screened traveling because of something else, like a flu, other than COVID-19, and they might be forced to be in isolation. So not an attempt to control. They are not here forever. Should we be reassured about this, in your view, Prof? Or people should really be paying attention to them and making sure that the appropriate regulations are indeed drafted?
Yes, I think we're long past the stage where we just trust the minister on the basis of their assurances. The fact of the matter is legislation gives people's powers to do things, and you don't authorize any party to exercise such powers without very, very careful consideration. So where a lot of discretion has been allocated in terms of a piece of legislation, huge discretion, you don't govern that, you don't limit that, you don't say, don't worry, we won't exercise all the discretion we have, just believe us, we will be decent. The problem is people haven't been decent. Government hasn't behaved appropriately. Parliament hasn't provided proper oversight of a framework. So we definitely do need procedures, processes, ensure proportionality. We need to be able to challenge certain arrangements. What we can't have is just somebody arresting you and putting you in some sort of confinement if you don't agree with them. Who is that? So as it stands now, this is very poorly drafted regulations, which allocate substantial powers to some unknown people who can make decisions. You just don't do that in a legal framework. It's quite clear it just hasn't been thought through. That doesn't mean that you shouldn't have a coherent legal framework to deal with notifiable conditions. All I'm saying is this isn't it.
Yeah, and we've had about some 100,000 contributions so far, and I'm sure more are going to be pouring in over the next week. Thank you very much for your time and reaction to this announcement of the extension. That's Professor Alex van der Heever.